Hello, hi, my name is Brenda Dungan. I'm a UTEP Family Nurse Practitioner student, and today I'm going to be doing a comprehensive exam on a patient. His name is JB. He's a 41-year-old patient that came in to the urgent care center for his chief complaint of a sore throat, coughing, and congestion, sinus pressure accompanied by a temperature over 100.5 for the last week. First and foremost, what's very important that needs to take place with any patient is we hand sanitize to prevent any infection from occurring. Okay. Hello, Mr. JB. How are you today?
Hi, not feeling too good.
Not feeling too good? Okay, what brings you to the urgent care center today?
I've been suffering from congestion, fever, and now my sinuses are starting to hurt.
Okay. How long has this been going on?
It's been about a week now.
About a week, okay. What has been making it worse?
I think the cold air is making it worse.
Cold air, okay. What's making it better? Are there any medications that you're taking?
Well, right now I'm taking Motrin for my fever. I've been getting headaches from it, so the Motrin's been helping that, and just lots of liquids.
Okay. Any other symptoms that you've had?
I think the cold air is making my cough, take place, and it's a very conductive cough.
And what type of cough is it? Is it productive or not productive?
It is.
Okay. What color is the
Phlegm.
mucus, the phlegm?
It's been coming out green.
Green. Okay. Does it have an odor to it?
Not that I can tell.
No.
My nose doesn't.
Okay. Okay. So what I'm going to go ahead and do is I'm going to go ahead and do a comprehensive physical exam. Is that okay with you?
Sure.
Okay. So I'm going to go ahead and start from the head and go down to the feet. Okay. First, I'm going to go ahead and check your head. Make sure that everything's intact. Okay. Can you open your mouth for me? Okay. Close it. Yeah, I don't feel any type of clenching or any tenderness. Do you feel any tenderness or swelling?
No.
No? Okay. So what I'm going to go ahead and do is I'm going to go ahead and ask you to take a sip of water. Okay?
Okay.
And then I'm going to go ahead and check your thyroid. Okay? Okay. Okay. So now what I'm going to have you do is I'm going to go ahead and have you do this. Hyperextend your neck. And you're going to go ahead and sip some water, but go ahead and not swallow it. I'll let you know when. Okay? Okay, go ahead. Okay. Okay, good job. Looking for is the trachea to make sure it's aligned. And I'm also inspecting the jugular vein to make sure that there's no vein distension. And I palpated right over here where his neck is, just to make sure that there's no tenderness or swelling. Okay? Now what I'm going to go ahead and do is I'm going to go ahead and check your eyes. Your pupils react. Just look at my nose. Okay? Okay. Okay, so what you're going to do is you're going to follow my finger, but you're going to keep your head straight. Okay? So I'm just going to be checking for cranial nerves number 3, 4, and 6. Okay?
Okay.
So, what I'm assessing for is to make sure that there's no tremors, no moving the head, and the head stays aligned. Okay, good. Okay, next is visual acuity. Okay, so with the visual acuity, what happens is that we would assess with a Snellen chart at 20 feet, and your visual acuity was 20/20 with corrective lenses. Okay?
Okay.
So you can go ahead and put your glasses back on. What I also assessed for with your eyes is to make sure that the sclera was no signs of symptoms of jaundice. It was white, no redness, no swelling, no exudate in your eyes. Okay, so next is your ears. Okay, what I'm going to do is I'm going to go ahead and check your maxillary sinuses. Okay, let me know if it's tender. Checking to see if there's any swelling, redness, tenderness. Does this hurt?
No. That I feel pressure.
You do? Right here?
No.
Okay.
I felt it more up here.
Okay. So what I'm gonna do is, if you can remove your glasses, and I'm gonna go ahead and check for transillumination. Okay. So I'm gonna go ahead and insert this, and if there's opaque illumination, that transillumination, that means that there might be a sinus infection. Okay, if you can open up your mouth. Okay. Okay. So I didn't see any. So that means that you might have a sinus infection going on. Okay. So next, go ahead and check your ears. Okay. So first is the inspection of your ears, and what we do is we inspect from the inner canthus to the alignment of the auricles. Okay, and it seems as if it's intact. Okay. As far as the ears, there's no swelling or tenderness in the external part of the ears. Okay, and the tympanic membrane, I'm going to go ahead and assess, okay? Okay, so what we check for is in the tympanic membrane that there's no perforation. The tympanic membrane looks pearly gray, which it does. And what you do for adults is when you're assessing is you pull back and up. For pediatric patients, what you do is you pull down and back when you're assessing. Okay, so everything, this looks okay. Okay, there's a little bit of cerumen buildup, but you know, it's not a lot of discharge or anything, no purulent discharge. Okay, back to the nose. I'm gonna go ahead and the nares. I'm gonna go ahead and check for your nares. Okay, make sure that there's no deviated septum. Okay. What I'm gonna do is I'm gonna look in back of your throat to see how it looks. Is that okay with you?
Yes.
Okay, it might stimulate your gag reflex, so just to let you know.
Okay.
Okay, I do see some redness behind the back of your throat. There's some white patchy areas, and I can see that that's why you've been having the symptom of a sore throat. Okay, why you've been having these symptoms. Okay, so what I'm going to do now is I'm going to go ahead and check your inside your mouth just to make sure that you don't have any nodules or swelling or anything. So go ahead and open up wide. Okay, normally what we would do is we would palpate in this section. I'm not going to go ahead and palpate, but there's no swelling, no redness, no discharge. Go ahead and open up your mouth, your tongue. Okay, looks okay. So now what I'm going to do is I'm going to do this tuning fork, and what you're going to do is you're going to let me know if you're able to hear on both ears. Okay, this is the Weber test. So what I'm going to do, okay, can you hear on both ears?
Yeah.
Okay, and this test for sensor neural loss. Next is the Rhine test. So I'm going to do this. I'm going to go ahead and check verbal conduction. Can you hear it on? Yes? Okay. Tell me when you can not hear it anymore. So what this test does is the air conduction should be twice as long as bone conduction, and in this case it was. Next, so what I'm going to do is I'm going to go ahead and check your hearing. I'm going to go ahead and say numbers to you or a phrase, and you're going to repeat it. You're going to go ahead and insert one finger in the ear,
Okay.
and you'll let me know what I say. Okay?
Okay.
And it should be out of the vision of the patient, but in this case, I'm going to go ahead and stand over here.
Okay.
Okay? Out of the way.
494.
Okay? So now on this here, okay, and out of the vision of the patient, I'm going to go ahead and say,
798.
okay. So next is the lungs. I'm going to go ahead and check your lungs. And first, in this case, what we would do is we would inspect the chest for symmetry and alignment. Okay? And what I'm going to do is I'm going to go ahead and inspect, and there's no symmetry, and there's symmetry. The chest is symmetrical, and I'm going to go ahead and assess and auscultate. I'm going to check your lungs, okay?
Okay.
So what I'm going to do is I'm going to go ahead and palpate the intercostal spaces. Okay. And then I'm going to go ahead and have you sit a little bit this way. Okay, in a real life situation, you would expose the patient, but in this case, I'm going to go ahead and, with his respect and privacy, I'm going to leave his shirt on. Okay, so what I'm assessing for is your lungs being that are symmetrical and there's no retractions. I'm going to go ahead and check for the front, right above your diaphragm. Okay. Take a deep breath. Deep breath in. Out. Okay, can you lift up your arm? Deep breath in. Out. In. Okay, I'm going to do the same to this side. Deep breath in. Out. Okay. Can you lift up your arm? Okay, so now I'm going to go ahead and go to the next section. I'm going to go ahead and check your heart. Okay. The symmetry is comparable to both sides of the chest. Upon respiration, respiratory rate is 20 per minute with even patterns, no retractions, no clubbing or pallor or cyanosis or discoloration. Capillary refill is less than 3 seconds to the upper and lower extremities. Trachea is aligned, midline above the substernal notch. And no palpation, no bulges, no tenderness, no crepitus was felt. So what I'm assessing for right here is the size of your liver. Make sure that there's no enlargement of the liver. Okay, so it's okay on this side too. And this assesses for your spleen. You doing okay? So now, the summary for the abdomen is no bruising, no discoloration, no tenderness was noted. The auscultation was loud, prolonged gurgles, which were present. Patient stated that he was hungry. Otherwise, bowel sounds were auscultated on all 4 quadrants. No brewery or frictions, rubs were heard. Okay, and abdomen is non-distended, no tenderness, no masses palpable. Okay, so what I'm going to have you do is I'm going to go ahead and have you sit up, and I'm going to go ahead and check your kidneys and let me know if you're having pain. So what I do is I check to the costovertebral angle. Are you having pain?
No.
No? Okay. So that assesses that there was no pain noted to the kidneys, to either right or left sides. Okay. The genitalia, in this portion, the physical exam was deferred, but the expected results was there was no discharge, no tenderness, no lesions or induration noted, and no hernias present, no edema or masses noted to the scrotum. Okay, so next is the musculoskeletal. Okay, so patient is able to stand. Can you stand up for me? Okay, and you can turn around. And what we're checking for is lumbar spine. Make sure that there's no lordosis, kyphosis, or scoliosis noted, and in this case there's not. Okay, muscle, the alignment of bones, joints, and surrounding muscles are noted. Okay, no inflamed joints noted. Okay, muscle tone is firm and tender. What I'm going to have you do is I'm going to have you lean on the bed just a little bit, and I'm going to have you lift up your leg. Okay, and I'm going to press down and you're going to resist. Okay, so that's good. How about your other one? This tests for muscle tone. Make sure that everything's intact. And it tests for muscle strength. Okay, no gross deformities. You can go ahead and take a seat now. No gross deformities noted throughout the body. And in this case, I'm just checking for any gross deformities noted in his upper or lower extremities. Next is the skin and nails. Skin is warm and dry to touch with no rashes noted throughout the body. There was a healed incision to the right lower quadrant of the abdomen. No excessive perspiration noted or no body odor. No cyanosis or discoloration noted. Capillary refill was 3 seconds to upper and lower extremities. No lesions noted throughout the body. The hair texture is fine, smooth, and color, which was sand brown with nails trimmed with smooth round edges, no clubbing or ridges noted. Okay, and the nail bed is pink with no lesions noted as well. Okay, now I'm going to go ahead and go through the neurological status. Okay, patient is awake and alert and oriented time, person, and place. Patient's thought processes are proper with no evidence of delusions or disordered rational thinking. Okay. Patient is able to identify and discriminate against odors, which tests for cranial nerve 1. Cranial nerve 2 is the optic, which is the visual acuity, which is a 20/20 with corrected lenses. Patient is able to raise up the eyelids. Can you raise up your eyelids? No extraocular movements. Pupils did constrict in response to light, and that was tested earlier. Motor intact downward, which was the eye movement, which was the cardinal gaze of the vision. Okay. Patient was able to open up the jaw and chew. which tests for cranial nerve number 5. The sensory is the sensation of the cornea and forehead and the eyelids. This tests the cornea reflex, but in this case I'm not going to be testing him. Cranial nerve number 5 also tests that the eyes are able to move laterally. And cranial nerve number 7, which is the facial, which is the facial features and its symmetrical movement of facial expressions and able to taste. Okay. The acoustic, I already assessed, which was cranial nerve number 5, which is the whisper screening test. Cranial nerve number 9, which is the gag reflex, which he did have a gag reflex when I assessed his throat. Cranial nerve number 10 has the midline uvula, and speech with no hoarseness is noted. The spinal accessory is the shoulders shrug with resistance. Okay, so you're gonna go ahead and, okay, and you're able to turn your head from side to side. Okay, and that tests for cranial nerve number 11. Cranial nerve number 12 is tongue is symmetrical. Okay, no fasciculations or atrophy noted. Okay, the finger to nose accurate test is the motor test, so you can keep on doing that. Okay, and the gait is smooth and regular. Is able to ambulate 10 feet without complications, which he's independent and he's ambulatory. Sensory is intact with superficial touch and superficial pain positioning of joints, and his sensory is intact to monofilament test with the bilateral fingers and toes. Now what I'm going to do is I'm going to go ahead and test his reflexes. If you can sit a little bit more back. This test needs to be, the patient needs to sit at a 90-degree angle, okay? And you're gonna go ahead and, this is testing for the patellar reflex, okay? And then the Achilles. Let's try. Okay. Okay. And for adults, the Babinski reflex is negative. In this case, it was as well. Okay, and babies, it is a positive test in infants. Okay, this concludes the comprehensive physical exam. Okay, I thank you very much, Mr. JB, for cooperating in this exam, and thank you very much.